Welcome back. My name is Dr. Andrew Grecki, physical therapist and owner of Superior Physical Therapy, and I'm going to answer one of the most common questions that I get from people that are dealing with back pain, specifically those people that are dealing with back pain that have arthritis or stenosis. And it's a really simple question, which is, how long should I wait before I get help for my back pain? And I think a lot of us are used to being younger, and when we were younger, we would have pain. And we'd hurt ourselves, maybe we had a little injury here and there, and we would heal pretty quickly. In fact, my 4-year-old, he'll heal so fast, it's unbelievable. So I think we got used to that for maybe 20 to 25 years, and as we get older, it becomes harder or slower for our body to repair itself. And so I see people in the clinic as a physical therapist very commonly will tell me they've had back pain for months, for years, even 10, 15, 20 years. And I always ask them and they ask me, well, when should I have come in and seen you? And I always kind of say, gosh, there is really actually a pretty scientific answer when it comes to that question. And it's really based on the science of healing. And so we're gonna go over that today right now, which is, how long should I wait before I get help? And really the simple answer is actually somewhere around 4 to 6 weeks. And let me explain why I say 4 to 6 weeks. So you can see here, we're going to talk about the 4 phases of healing. I have an image here that you can see there's actually 4 phases to the healing process. And this is the same whether it's a cut on your skin or a tissue damage inside of your body, whether it's the nerve being compressed, in this case from the hole closing down, that actually damages the nerve and actually damages the joint and causes tissue damage, which phase 1 of the healing process here you can see is called hemostasis. That takes about 1 to 3 days. Phase 2, however, is called the inflammation phase. That lasts from about 3 days to 20 days. And so that's interesting when you think about inflammation, because a lot of times we're actually treating inflammation in order to relieve our pain. Maybe it isn't the best idea. In fact, there's studies now that show that treating inflammation only actually delays the healing process. Things that would help us treat inflammation might be like ibuprofen or aspirin. Injections in the spine will oftentimes treat the inflammation that's occurring. And yet it's the second phase of healing, and it lasts between 3 and 20 days depending on how much damage there is to the tissues inside of our body. And you can see that we've got the phase 3, which is granulation, and phase 4 here, which is maturation, which can take a minimum of 6 weeks and can last up to 2 years. So you can see here that in the 4 phases of healing, the minimum amount of time is around 6 weeks. So if you're struggling with pain in your back, or you, again, have that sciatic pain that travels down the back of your leg, oftentimes that's going to be pain, numbness and tingling, sometimes even weakness. There's a really good chance that in the next 4 to 6 weeks it's going to go away on its own if the thing that was causing it in the first place, the thing that was causing the hole to close down and the damage that's occurring is not there anymore. That's really the trick. If we're only treating inflammation, it will delay the healing process. And if you're trying to wait it out and let your body heal on its own, you should really be thinking about somewhere between 4 to 6 weeks. If it's not getting better, you should consider seeing somebody that's going to be able to address the movement-related pain. That's the key. So physical therapists are the movement experts. We're going to help you identify the movements that are closing the hole down. We're not just going to mask the symptom of pain by treating inflammation. We need to address the thing that's causing the hole to close down. In fact, not only that, but we also need to teach you how to open up the hole so you can get pain relief. Another popular question I get is, should I get an MRI for my back pain? And that's a really, really common one. I think almost every patient that I meet with back pain wants that MRI. And if you can remember earlier, we were talking about that study, the study of the week that shows when they gave all these thousands of people an MRI and without pain, they had no pain, so they're just random people without pain. 80% of people over the age of 60 have stenosis in their spine on the MRI, but they have no pain. So the answer to that typically for me is I think getting an MRI makes it harder for people like me or the doctor to help you with your back pain, because it makes us think that that's the reason you're having back pain, because you have this aging and the hole is closing down. And when in reality, we know that the type of back pain usually isn't the cause of back pain. So So I think oftentimes it leads people down a path of unwanted, maybe unnecessary medications, injections, and surgery because they got that MRI. Now there are some situations when you should get an MRI. And so those are called red flag scenarios. So one red flag is if you have any changes in your bowel or bladder function. So you have back pain, you have sciatic pain because of stenosis, maybe, and you have changes in your bowel or bladder function. That's like an emergency situation where you should talk to a doctor, maybe even the emergency room, and you need to have an MRI to find out what's going on. A second one is if you start to get foot drop. So if you get foot drop in your foot and you have back pain and it travels down the back of your leg, that's also an MRI situation. And then there's really two other situations. If the doctor suspects that you have an infection or that there's a fracture. So if you have an injury where you fell and somebody thinks you have a fracture, again, that image is really important. Otherwise, for people suffering with back pain and sciatica, without those red flags, there's really no good reason why you should have an MRI. You should think of an MRI as a pre-surgical tool. So if surgery is warranted, if you think you're going to have surgery, which I would highly recommend you don't, trying other things, naturally healing, then I would try to avoid having the MRI as much as you can unless you have those red flag symptoms.